Okay, I guess I'll start with Dr. Todd Tessendorf. He's a cardiologist here at Bryan Heart, and he was at Columbus Community Hospital during the initial phases of treating Don. So, Dr. Tessendorf, can you just kind of highlight what were some of the issues that Don was going through, and what was your role in his care?
Yeah, sure. So Don got referred for a heart murmur. Most heart murmurs that we listen to are typically caused by either a narrowed heart valve or a leaking heart valve. And so the first test we ordered when he was in the clinic was an ultrasound of the heart. We call that an echocardiogram. And you just do it through the skin of the chest and just take ultrasound pictures of the heart. During Don's echocardiogram, he was found to have a very large aneurysm, basically a dilatation of his aorta. The aorta is the main blood vessel that comes off the heart, and it was well beyond what we would expect it to be, a very, very dangerous aneurysm. And so we actually sent him over to the hospital emergently for a CT scan of his chest. And that found that he clearly had an aneurysm, but also looked like a small tear in the heart, what we call small tear in the aorta, what we call an aortic dissection. And so we urgently transferred him down to Bryan for Dr. Oak's evaluation.
Great. And yeah, so this would where we would have Dr. Oakes kind of hit on his part, but just to give the media an idea. So Dr. Oakes performed the aortic valve replacement, the aortic root construction, and the ascending aorta replacement. So it was a complex procedure that lasted several hours, but thankfully the procedure went well with no complications. And after a few days of recovery, Don and Mary were able to go home. So it has a happy ending. Don and Mary, I'll bring you guys in here. So I guess take us through that situation when you see Dr. Tessendorf and you get the news that you need to get to Lincoln for a emergency procedure, and you had no symptoms before this. So what's kind of going through your mind when you're hearing all this news and knowing it could be a serious issue?
You're talking to me? I really didn't know what was happening. It was, in fact, all through the first, day or so, I really didn't realize anything was serious. And so probably just lucky that I didn't know what was going on.
Dr. Tessendorf was very calm about the whole thing. He just said, we need to get you to Lincoln. And so we packed the bag and headed to Lincoln, and Dr. Oak was waiting for us when we got there. So we felt like we were in good hands through the whole thing. It was something you don't want to have to experience. From Columbus on into Lincoln and at the hospital, just took very good care of us. Kept us informed exactly what was going on. They thought that night they may have to do the surgery, but then they realized he was stable and he could wait and do it first thing in the morning, which is what occurred.
Great. Thank you. Media, if you have any questions to submit, feel free to go ahead and do those at this time, and I can relay those to our two participants. While we wait for that, Dr. Tessendorf, could you just kind of touch on, how important it is to have those regular checkups and then the continuity of care to get Don and Mary from Columbus to Lincoln so quickly, and how important that can be, especially when you're dealing with the heart and some serious issues there?
Yeah, for sure. Certainly, as you touched on earlier, heart disease is the #1 killer in the United States. Outbeats cancer, outbeats COVID right now, which is on everybody's mind. So it's still really important to get routine screenings with your family physician, and if they do identify any sort of concerns, to meet with the cardiologist, and then we can do our assessment and kind of move forward from there. In Don's case, clearly this type of aneurysm, and again with his CT scan showing what looked like a partial dissection, those can be absolutely surgical emergencies. And so it was very important to get him down to the hospital immediately in case something were to happen. with these type of dissections, sometimes they can propagate and tear even further, which can obviously be a disastrous outcome. And so getting him transferred down that night was critically important to his care. So, and fortunately, you know, he did very well, obviously, with surgery. So yeah.
We had a question here from Matt for Dr. Tessendorf. Matt was wondering, how common or uncommon is it for someone to have this serious of a condition, but show no symptoms, really have no idea that this is happening?
Right. So most people with ascending aortic aneurysms, which is just the dilatation of the aorta, they're almost always asymptomatic until they tear. There are certain things that make you more predisposed to having aneurysms of the aorta, most commonly high blood pressure. And so making sure you get your blood pressure treated to an appropriate level is very important to help prevent this. There are a lot of genetic diseases that can contribute to these aneurysms. The most common ones would be something called a bicuspid aortic valve, where the valve also causes dilatation of the aorta. Marfan's disease, there's something called Turner syndrome. Those would be the most common genetic complications or predispositions to aneurysms of the heart. There are some, you know, family genetic people that have what we call thoracic aneurysms. There's a genetic link as well, but they're still fairly uncommon. I think the rate is about 6 to 10 per 100,000 per year. So I don't think it's terribly common, but we see it, you know, frequently.
Don, and also for Mary, can you speak to how your life has been since this procedure? Did it help you feel better? Are you still able to do the normal things? Just maybe paint us a picture of what your life looks like on the other side of this procedure and how you've been doing since this happened.
He's doing everything he did before. It's been remarkable. Once he recovered from the surgery, he's just picked where he's from. He's retired, but he has not slowed down in his activity or anything really. So he went in one way and came out, I'd say better, by far better. Yeah, so he's very thankful for that. Yeah.
Okay. We can wait just a sec here to see if any other questions pop in from the media.
One thing on Don, I just saw him in clinic a few weeks ago and he looked great. So had a good checkup.
Yeah.
Thanks for that.
Elaborate on that. So what would be the follow-up care for a patient that undergoes this, Dr. Tessendorf? Would you kind of hit on that and how closely you monitor them and things like that?
Yeah, sure. So part of Don's procedure obviously was not just replacing or repairing the aorta, but given the dilatation of that aortic root, his valve had to be replaced as well. So periodically we'll do ultrasounds of the heart to follow up on the valve itself and also the aneurysm and the repair coming off the heart. He's had a wonderful outcome. His valve has been, you know, functioning perfectly. And as he mentioned, he's feeling well. And so, you know, early on, there's, you know, several checkups after the first year of surgery, but at this point, it's just once a year unless he has issues. So again, at 89, I think he's doing pretty well.
All right. And I did want to actually mention one more thing with Donna and Mary now. It's my understanding, Mary, that after the procedure, you knitted a quilt for Dr. Oakes and the team at Bryan Health. We have a couple pictures of that we'll share with the media afterwards. It's a wonderful quilt, but let's talk about why did you do that? Why was that something that you wanted to do? Just touch on that. It's a special gift, and I know it means a lot to the staff.
Well, I was very thankful, first of all, for the care and everything that he received. And when we were closed in the house pretty much with the COVID, I decided that was a simple enough way to say thanks. And so that's why I made it and sent it on to one to Dr. Oakes and one to Stacy, who was our navigator when we left the hospital, and I used her a couple times back home, which was a wonderful help to us being so far from Lincoln. But so it gave me satisfaction to say thanks to the staff and to the doctors in general purposely for what they did for us.
Great. Very nice gesture. And I know it's hanging on the wall upstairs, so it certainly means a lot to those staff. Dr. Tessendorf, there's no other questions coming in, but I thought maybe a one way that we could end this Zoom, unless any questions come in, is, what can people do to monitor their heart health? How can they keep their heart healthy during February and throughout the whole course of the year? What are some things that they can do? And then what are some warning signs that's maybe say, hey, we need to get this checked out if these happen?
Yeah, sure. So the best way to keep your heart healthy is to do the things we kind of already know how to do. Want to keep your blood pressure controlled, as we mentioned earlier. I think cholesterol control is critically important. I think diet and exercise are very important to a healthy lifestyle, and so those get overlooked. They're some of the hardest things to do, is to eat healthy and exercise, but they're critically important to long-term heart health. If you have diabetes, which is very common, controlling your blood sugars can help avoid people like me. The warning signs of heart disease is chest pain would be the most common one. Men with heart disease, particularly blockages in the heart, typically get chest pain, shorter breath. Women, on the other hand, still get chest pain, but they don't always have the typical symptoms like men do. Sometimes it can just be shortness of breath. Sometimes it can be arm pain. Sometimes it can be jaw pain, pain between the shoulder blades. Sometimes just nausea can be a sign of heart disease. And so women in particular need to have a much more higher sense. They need to get in and see their physician right away to be evaluated.
Okay. Don and Mary, is anything that you want to add or say that we haven't talked about? Maybe a finishing thought or a closing remark?
I guess just a thank you to the staff and everybody at Bryan Heart. They just took care of us so well, and we just followed what they told us, and it took away so much of the anxiety. They just seem to have, they have the floor up there and many other areas in the hospital, I'm sure, with people with heart issues, and they treated everybody as if you were the only one. They always had time for you. And we saw doctors every day. It was very comforting. And I think people need to know that you are taken care of well.
Okay, well, thank you. Before we depart, I did want to clarify one thing. I misspoke earlier. So Dr. Tessendorf actually saw Don in our Bryan Heart Clinic in Columbus. It wasn't at Columbus Community Hospital. It was a separate clinic before he went there. So just to clarify that for the media.